Are broken administrative processes and subpar technology compromising our medical care? As stimulus dollars fuel the adoption of EMR technologies that support clinical operational excellence, U.S. hospitals continue to circulate patient consent forms, physician queries, administrative, HR, and risk management forms using an inter-office mail cart. So what's the cure? In this program, two of the leading experts in the industry, Barry Runyon, Research Vice President at Gartner, and Sean Curtis, Director of Product Management at Formfast, diagnose why information technology will play a widening role in collaborative care, with workflow automation and business process management as two major drivers of this growth. And we begin with Barry Runyon. Barry is a Vice President for Healthcare Research at Gartner, and drawing on his extensive experience in the healthcare space as a consultant, systems architect, and C-level executive with an academic medical center, Barry will explain why he says hospitals need to repair herky-jerky processes. He'll also look at how workflow automation can strengthen your bottom line through improved customer satisfaction, streamlined processes, cost reductions, and resource optimization. Barry, welcome to the program, and let me turn it straight over to you.
Hello. Good morning or afternoon, depending where you are. My name is Barry Runyon. I'm a Research Vice President with the Healthcare Providers Group at Gartner. As such, my agenda surrounds many of the underlying information technologies found in the healthcare delivery organization, from the large physician office to the community hospital to the university medical center, all the way to the integrated delivery system. I'm most interested in what existing and emerging technologies have the potential to improve a healthcare delivery organization's clinical and financial outcomes. In this presentation, I focus on some of the challenges that have surfaced as a result of increased demand and access, healthcare reform, and the unrelenting automation of business and clinical workflows. Information technology and related standards have taken on a more prominent role in supporting the healthcare delivery organization's effort to improve care quality, reduce costs, and increase revenue. Healthcare delivery organizations benefit most from information technology when they anticipate and plan rather than merely react to them. A healthcare delivery organization's business model, along with its corporate ambitions and tolerance for risk, drives the adoption of most technologies. This graphic is part of the scenaric thinking exercise Gartner healthcare analysts did late in 2009. Scenarios are useful to provide a long-term context and inject some more radical alternative future possibilities into near-term thinking and decision-making. It allows for the exploration of possible situations regardless of the desirability or likeliness of that eventuality occurring given today's realities. As part of the exercise, Gartner examined the three major forces affecting care delivery and select two critical uncertainties as axes to model future healthcare delivery scenarios. Critical uncertainties are the most important major forces that drive an industry that are also the most uncertain. In this case, they were proximity, or the degree to which delivery of healthcare is freed from the constraints of physical location, and incentives, the principles that govern how healthcare providers are paid. Payment incentives range from activity-based, a clinician being paid for patient encounters, to value-based, a clinician being paid for how healthy he gives his or her patient. Proximity range from virtual, clinician and or patient being remote to one another, to physically present, or the normal face-to-face encounter. These two axes created four alternative future scenarios for healthcare delivery: centered care, value-based and physically present; continuous care, value-based and virtual; convenient care, activity-based and virtual; and herky-jerky care, activity-based and physically present. In the centered care scenario, care delivery is value-based, but still bounded by the physical proximity of the provider and the patient. Most care providers publish quality statistics and are compensated through pay-for-performance initiatives, but most care is still delivered through face-to-face encounters. IT priorities in this scenario focus on enhancing and streamlining the clinician and patient experience, so clinicians can spend more time with patients, and on consumer analytics to better understand patient wants and needs. In the continuous care scenario, care delivery has become more virtual and provider incentives are more value-based. Patients are no longer tied to local practitioners because so much care is now handled remotely. And these patients can make more informed decisions because much more provider quality care is available. In this scenario, IT priorities include offloading most of the busy work of patient monitoring and first-level interactions to automation and providing excellent clinical decision support. In the convenient care scenario, care delivery has become substantially virtual, but payments remain largely activity-based. The healthcare consumer must coordinate his or her interactions with multiple providers of care with minimal information on the relative quality of the care provided. Healthcare delivery organizations' IT initiatives in this scenario would focus on making healthcare access much more convenient and ensuring that provider services are highly available and secure. In the herky-jerky scenario, care delivery is dominantly activity-based and delivered in local, face-to-face encounters like now. Payment is based on activities with little attention to longer-term value, forcing healthcare delivery organizations to optimize all patient-physician interactions based on utilization and workflow. IT investment priorities for this scenario include those that drive high increased utilization along with continuous improvement methods for driving waste and cost out of the system. Gartner believes that we are currently ensconced in the herky-jerky care quadrant. And based on our evaluation of the current trends, we believe that there's a high probability that the entire industrialized world will remain in that quadrant for some time to come, although it is likely there will be some movement toward the upper right-hand corner of the quadrant. To ensure future success, healthcare delivery organizations should focus on IT investments that assist them in mastering and optimizing their most important business and clinical workflow processes. This will be necessary to foster enterprise agility to substantially modify service delivery approaches. This includes making IT investments that enable real-time monitoring of the enterprise, awareness and business intelligence platforms, continuous improvement best practices, and robust workflow automation, business process management, and change management. For decades, we've been talking about the problems of healthcare and how the situation has become untenable, particularly the challenges surrounding cost, access, and complexity. To begin to address the situation, Congress has passed the American Recovery and Reinvestment Act, also known as ARRA, and more recently the Patient Protection and Affordable Care Act. These pieces of legislation will help usher in healthcare's decade of transformation. This time around, expect to see changes in the organizing principles surrounding healthcare, with an emphasis on collaborative care that deliberately leverages information technologies of all types. Collaborative care in the form of accountable care organization and the patient-centered medical home are essential elements of recent healthcare reform. The days of "trust me, I'm your healthcare provider, and we know what we're doing" are long gone, to be replaced with quality transparency and increased healthcare provider accountability. Healthcare delivery organizations need to be prepared to collect, analyze, and report on an increasing number of quality and efficiency measures. They must be prepared to become more efficient, to better define and defend their treatment practices and care quality, and to put in place programs of meaningful and continuous improvement. We live in a world which clients demand more for less, delivered yesterday at the best price, with the least risk, and just the way we like it. This requires incremental and continuous improvement in a near real-time fashion. The graphic at the bottom of this slide depicts, at a high level, the overlapping modeling, execution, measurement, and adjustment loops that represents an incremental and continuous refinement approach to process improvement. It includes the events, the rules, data, the processes necessary to optimize the critical clinical and business workflows and processes of a healthcare delivery organization. Creating a culture of incremental and continuous improvement will be a challenge to the average healthcare delivery organization going forward. As this slide suggests, there will be a tangible focus on accountability during this decade. There will be much greater pressure to control costs while simultaneously improving quality. There will be increased transparency surrounding the value of a healthcare delivery organization has to offer and how they compare with like and competitive organizations. Risk-sharing payment models will be devised, and they will be tied to an overall value of care and services delivered. Healthcare delivery organizations will be refocused to be more patient and consumer-centric, with initiatives such as prevention, wellness, disease management, and a greater emphasis on personalized medicine. Healthcare delivery organizations will be obliged to use information technology in a more meaningful way, and to use it to satisfy the demand for coordinated care across all the care venues. By Gartner's definition, the real-time healthcare system advances its effectiveness by using up-to-date information to progressively remove delays to the management and execution of its critical business and clinical workflows. The real-time healthcare system is a management paradigm that uses new and existing information in a different way, accelerating individual processes to minimize response time and to optimize response quality. While this sounds straightforward, healthcare professionals know that viewing individual clinical and business processes as discrete and independent fails to consider the complex interactions, handoffs, dependencies, and often unintended consequences of changes among the healthcare delivery system's hundreds of activities going on at any point in time, performed by a wide variety of roles in a variety of administrative and care settings. Minimizing time to response is not as simple as accelerating a single process and optimizing the quality of a response, and may require complex coordination across all of the interacting people, processes, and enabling technologies. The real-time healthcare system's focus on speed can be comfortably aligned with the lean methodology focus on waste. In other words, time is money. Time is also risk and morbidity within the healthcare provider. To realize the real-time healthcare system involves the strategic use of IT and communications technologies and the real-time business intelligence necessary to improve patient care and outcomes and balance demand and resources. The real-time health system is therefore dynamic, aware, and demanding. It demands up-to-date information to progressively remove delays to the management and execution of its critical clinical and business workflows and processes. It is acutely aware of resource availability constraints and the necessary business processes to deliver safe, quality care. It has a need to ensure high levels of service, operational efficiency, and top-quality end-user experience. To do so, it must support an increasingly mobile, collaborative, and remote workforce across multiple care venues and make use of real-time business intelligence to continuously monitor and rapidly adjust business, administrative, and care delivery workflows. It must leverage disciplines like Lean and Six Sigma to eliminate waste, improve quality, and to accelerate workflows and business processes. To remain competitive, healthcare delivery organizations must evolve. In order to successfully operate in real time, they must expand their use of automation, instrumentation, presence, location and condition sensing technologies, event-driven and service-oriented approaches, messaging and interoperability, wireless and mobility, and integrate a host of important workflow and process changes that enable the real-time enterprise. Most importantly, they must redesign and transform their critical clinical and business workflows and processes, and enhance their IT and communications infrastructure, systems, and technologies to operate more efficiently and collaboratively. Tools like forms and workflow automation, business process management, document management, and enterprise content management are among those that enable the real-time healthcare system. They change the view of a healthcare delivery organization's IT environment from a host of disjointed applications and systems to one of overriding workflows and business processes that control, mediate, and coordinate the activities of its people, applications, and systems and business processes. There's a pressing need for workflow and process automation in nearly all aspects of the healthcare delivery organization, from the front office to the back office, and admissions and discharge processing, medical records, materials management, purchasing, the supply chain and revenue cycle management, but none are more important than the clinical workflows that are at the heart and soul of the healthcare provider enterprise. Gartner recognizes several macro-level workflows at work in the average care delivery organization. These are the various workflows necessary to arrange, deliver, manage, and account for patient care. Some of the systems used to arrange for care include systems like patient registration, admissions, enterprise scheduling systems, and more recently, patient portals and kiosks for self-registration, appointment requests, and other administrative tasks. Those required to deliver care include systems like the computerized patient record, and the various departmental and medical imaging systems that contribute to the longitudinal medical record. Systems required to manage care include patient throughput and logistics systems such as bed management, asset tracking, disease management, and quality measurement systems, as well as preventive care and personal health management tools. Then there are those systems required to account for care, such as medical records, billing, claims processing, and revenue cycle management. No matter how you categorize these applications and systems, there are those that are administrative, financial, foundational, clinical, and customer and care delivery related. Many of these systems are moving closer to the point of care and to their constituents, the consumer, the patient, the hospital employee, and the clinician. They are focused on improving operational efficiency, increasing consumer convenience, improving the quality of care, generating revenue, and promoting patient safety. Successful work outcomes depend on well-executed workflows and processes. There are many aspects of processes that must be coordinated to achieve excellence: people, systems, rules, policies, sequences and workflows, documents, decisions, and others. To date, systems automation has done a good job of reducing reliance on manual efforts by automating many routine, repetitive tasks that use the structured data and occur in a predictable sequence with few business rules. Control over such activities and data has been embedded in the flow control logic of the application system. However, there remain many aspects of work that are rarely automated or even coordinated by software, such as manual exception handling, dealing with unstructured information, collaboration, decision-making, negotiations, approvals, and paper workflows. Today's requirements for business process management are much bigger than the automation of tasks that is typical of transactional applications. Process management is shifting toward explicit coordination of all the resources, information, and workflows. The application silos that exist in most organizations are simply a reflection of siloed business functions. Business and IT leaders need to care as much about the end-to-end process and workflows as they do about the applications and systems that are under their direct control. Business process management, or BPM, within the healthcare delivery organization is about helping business and clinical users drive business efficiency and agility through task, workflow, and process change. These changes can range from modest to completely transformative. Continuous process improvement initiatives may result not just in improved workflows, but significant changes in the way a healthcare provider organization does its business and delivers care. BPM is a management discipline that can be and is often enabled by software systems and associated technologies. Although BPM enabling technologies can help throughout the business process life cycle, a technology-first approach to BPM is likely to result in failure. The key challenges that organizations face with BPM initiatives are a lack of understanding and expertise in workflow and business process automation, a lack of clear requirements, that is, a detailed understanding of their own workflows, organizational cultural pushback, and a lack of centralized responsibility and governance. Although software is not a strict requirement for BPM, workflow and business process modeling tools help make workflows and business processes more visible and explicit and easier to understand. Workflow and BPM tools allow organizations to capture implicit process knowledge as intellectual property, as an enterprise asset, if you will. It provides for transparency, consistency, and can go a long way in satisfying industry compliance requirements. Workflow automation and business process management helps companies thrive by increasing productivity and reducing waste, directly or indirectly, by way of workflow and process improvement. It can improve customer satisfaction through visibility, self-service, responsiveness, and flexibility, and streamline processes and reduce costs by eliminating redundant and outdated steps, data, and procedures. It can optimize resources by routing work based on rules and increased quality of service and work products. It can shorten cycle times by closing gaps in handoffs and exception handling, and reduce risk by seeing transactions actually in progress. By combining workflow automation and BPM with continuous improvement methodologies like Lean and Six Sigma, these benefits can compound over time, That is, the value of the original investment in workflow automation and lean and other continuous methodologies is realized not just through improved productivity, but through more universal and compelling changes to the enterprise culture, job satisfaction, and overall attitudes toward risk-taking and innovation. Lean manufacturing, or lean production, or simply lean, is a production practice that considers the expenditures of resource for any goal other than the creation of value for the customer to be wasteful, thus a target for elimination. Working from the perspective of the customer who consumes a product or service, value is defined as any action or process that a customer would be willing to pay for. Basically, lean is centered on preserving value with less work. Lean manufacturing is a process management philosophy derived mostly from the Toyota production system, renowned for its focus on the reduction of the original Toyota 7 wastes: overproduction, unnecessary transportation, inventory, motion, overprocessing, and waiting, all done in an effort to improve overall customer value. It is based on optimizing workflow, increasing efficiency, decreasing waste, and using empirical methods to decide what matters, rather than uncritically accepting pre-existing ideas. Combining forms and workflow automation, business process management, and lean methods can have a dramatic effect on the efficiency, operational timeframes, and costs. This approach can expedite workflows and business process to such an unprecedented degree that an organization often needs to rethink how it plans and staffs. For an IT organization that is trying to adopt lean, or any other formal quality improvement method, it's useful to identify early opportunities that involve a known problem that can be fixed or improved. There are many. This then becomes a very helpful case study and builds credibility and credentials, making subsequent lean initiatives easier to sell to the enterprise. IT leadership should support top leadership's introduction of a methodology like lean. Become informed on the topic and lead IT into becoming a significant contributor to the cultural transformation necessary for lean to succeed. As previously suggested, workflow automation and business process management is about helping healthcare delivery organizations drive business agility through workflow and process change. These changes can be modest or transformative, and continuous improvement initiatives can yield real business transformations that will be required over this next decade. BPM initiatives can include forms and workflow automation, business rule development, business activity monitoring, document management, and enterprise content management, to name a few. BPM that includes forms and workflow automation and document management results in less paper, higher quality information, faster storage and retrieval, along with better information integration throughout the entire enterprise. More efficient workflows and processes beget increased staff productivity and often improved clinical and business outcomes, along with increased revenue and operational savings. Less tangible but no less important byproducts of BPM include enhanced customer satisfaction as a result of improved patient safety, improved patient throughput, and better care coordination across all administrative care venues. Healthcare delivery organization IT leaders should consider the following IT action plan. On Monday morning, begin educating stakeholders and IT personnel on the characteristics of the real-time healthcare system, the state to which their organization is rapidly evolving. Identify which workflows and business processes are high priority and those which help you improve outcomes, increase revenues, and decrease costs. In the next 90 days, evaluate how dynamic these workflow and business processes that run your organization really are and how they can be optimized. Begin to identify the forms, the documents, the application systems that will need to be digitized and integrated to efficiently participate in high-priority workflows. Be sure to allow the end user and stakeholder the opportunity to influence forms, workflow, and process designs. In the next 12 months, adjust your 3 to 5 year IT plan to reflect the more demanding workflow requirements in patient care and revenue opportunities inherent in the real-time healthcare system. Make sure that your healthcare delivery organization is prepared to participate in coordinated and collaborative care. This will likely involve significant workflow, technology, and governance improvements. I'd like to thank you for your time today. I know you all have plenty to do, and I hope this presentation has provided you with some insight into what will be happening within the healthcare provider during the next decade, and the role of tools and technologies like real-time monitoring, continuous improvements, forms automation, document management, workflow, and business process management in that transformation. We are at the cusp of an exciting decade in healthcare, and your active participation will be required.
Barry, thank you for those great insights and guidance. Barry Runyon is a Vice President for Healthcare Research at Gartner. Now, with all the issues and options that Barry put forward, a lot of you may be thinking, where do I turn for help? For that answer and more, we turn to Sean Curtis. Sean is the Director of Product Management at Formfast. Sean, thanks for joining us today. And I'm sure you are anxious to build on what Barry said, so I'll turn it right over to you.
Thank you. Formfast is the sponsor today of this webinar. So I wanted to take a minute just to show you who Formfast is. We are the leading provider of automation technology to hospitals. We have well over 800 customers, large and small, including IDNs and delivery networks. We're committed to the long-term growth of our customers. We've had customers that have been with us from the beginning 19 years ago, and we've carried them through various stages of maturity using our technology, and we've learned from them, and we've helped them grow as well. We're committed to understanding the needs of our customers and delivering information that helps our customers and the general market grow and meet the goals that they're going towards. We're also committed to delivering bottom-line results that you can count on. We're experts in hospital workflow, process improvement, and document automation. We use that expertise to help our customers move forward and move towards the goals that they're going towards. What we are is experts in hospital workflow, process improvement, and document automation. What we're here to talk about is improving processes in your hospital. Barry talked about real-time enterprise-type paradigms, and we support that, and we support process improvement. And why are we doing that? Is to eliminate human error. One thing we find a lot is that the errors come in when you allow people to key in information or require people to key in information or write that onto documents or enter that themselves redundantly. And so what we do is we provide a platform that integrates that data, so there's less opportunity for people to be responsible for entering the information. We also reduce the process times because everything takes place electronically in real time compared to, say, your push cart with important documents that goes winding its way through the hospital. Formfast moves information instantly from person to person or throughout the process. So we're reducing the time that it takes to process requests and approvals and information. And then we identify and eliminate unnecessary activities. So within your organization, when we look at these processes and we work with our customers to automate these processes, we often find that the processes can be much more efficient when it is done electronically. And that leads to the increased efficiency and effectiveness of your staff. A lot of times in these processes that are in place, they've been in place and people have been working with these processes for years. So they just do their work as they've been told to do it or how the process has evolved naturally. And what we can do is then take a look at where your steps are unnecessary and eliminate those steps. And a lot of times hospitals are using one of their most expensive and valuable resources, which is people, to shore up their processes. So using people to make routing decisions based on information that might be in a form or key in information that's in a system, that type of work can be eliminated with Formfast and automated, and the people can then focus on more value-added activities. When you take your processes to an online format, then you're also able to increase your data points to support your evidence-based decisions, which is a big thing today with all the pressures on hospitals and organizations to work more efficiently, is to have that data and understand what's happening in your organization so you can work more efficiently and target your information and target your efforts towards what your goals are. So our solutions overall support compliance, revenue cycle, administration, clinical, technology, and other initiatives that you may have. So this slide is our maturity model that we talk about in a hospital and organization, starting at the bottom with paper forms and pre-printed forms and moving up that pyramid through a maturity model of how organizations grow. And at the top of that pyramid is electronic document workflow and business process management. So we support organizations. We look at where they're at today, and we try to move them and give them the tools to go towards the top, because that's their goal, is to be paperless, more efficient, and our goal is to give you the tools to go up that pyramid. So at the bottom of this pyramid, what we do is help you eliminate your pre-printed forms, eliminate the storage and distribution costs of those pre-printed forms and the waste and obsolescence of those pre-printed forms, and then dynamically barcode with a patient ID and form ID so that they're ready to go into the next level, which is electronic archiving, electronic content management. We output barcoded wristbands and convert paper to electronic forms and help you output things automatically with less personal decision, less human decision involved in the processes. So once you've eliminated your paper forms and you've got print on demand and things like that, the next level is to make those forms more interactive, giving users direct input into those forms, allowing it to be used in a process for request and approval, to automate many of the processes that are still being required to be printed out and using a paper form, or even eliminating processes that have no form or no formal structure, and taking that through business process management and process improvement, using our technology as a supporting tool to provide that workflow automation. So this has effects across the organization, and this slide talks about what areas we can affect quickly and easily. And the goal of the fast flow solutions is to allow you to have a single platform to improve workflow, to improve your effectiveness and your efficiency across your organization. So using a single tool, we can help you affect positively your revenue cycle, your compliance initiatives, your administrative area, including HR and just the running of your business, the clinical areas, your physician satisfaction and physician use, supply chain optimization with contract approvals and requests and product evaluations. So across your organization, you can take one tool set and automate many processes and share that information and that tool across the organization. So as Barry was talking about, workflow has become less targeted around just departmental things. But now this is an enterprise application. So now you're collecting information in an enterprise way, sharing that information across the enterprise, using a single tool to help you communicate better across the organization and share that information. So the next step is to kind of illustrate this with a quick sample. So I'm going to take a look at, say, a purchase requisition, which is something that everybody kind of is familiar with. A user makes a request from their supervisor. A lot of times that's done on a paper form, and then it gets put into an inter-office envelope and pushed through the hospital in a cart, and it may take weeks or months to be completed. So what FastFlow is offering is the ability to take that and make it into an electronic form, one that's probably got the same type of business rules that you're already using, but the system knows those rules. So it's not relying on a person to actually decide where this needs to go next. And it happens in real time. So when the initiator, the person who's making the request, fills out this form, they're going to put in information like the cost and things like that. Then our system is going to look at the total cost of this product purchase request and see that it's over a certain limit, which looks to a business rule in the background that says if it's over $10,000, it needs a higher level of approval. So since this one says it's at $18,000, it's going to be routed differently than a lower dollar amount would be routed. And our system just takes care of that. So it's going to route for a first approval from a department head and then a next approval from a vice president. If it's under that $10,000, it would go directly to the next step, which might be purchasing. The nice thing about this system, and we're looking at a kind of a simplified process map here, but the nice thing about the system is it's really easy to configure your business rules into the processes that are going to take place. So in our system, there is no coding. You'll never have to script anything or code anything at all. It's all through a web interface. You just select what you want to do, and it's really just a click-through wizard type interface. So no two hospitals are alike as far as how they even process a purchase request. So even more complicated workflows and applications can be created through our tool quite easily, and build in the rules and the logic and the optional routing can be done fairly simply. This isn't really an IT tool. This is actually a tool that can be used by some super users or some good users who understand the process and actually control the process and can make this electronic. So it's not going to be a burden on your IT group. It's actually going to be a great helper for your organization to become more efficient using its resources that you already have. Once we've collected all this information through this process and this workflow, we've done this electronically, so we now have this in a database. We can collect that information. You can run reports against the information. We have a report tool inside our FastFlow, and that allows you to identify where you might need to do more training or increase your documentation or change your policies, because you can see that even if it's based on just the usage of this particular form identifies an issue, or maybe it's the content of the form that identifies the issue. Now you have access to that information automatically. You don't have to have somebody who goes through your stack of papers and keys this information into a spreadsheet and then analyzes it. Now, users are entering information just as part of their daily workflow, and you're able to visualize that quickly and make changes immediately so that this can affect your patient safety, your compliance issues, the way that your organization works. So this can have a huge benefit across your organization. And the data is not just available to one specific department. This is available to all of administration. So you can get into administration of your entire organization as a single entity rather than departmentalizing and making more silos of information. So that's a general overview of what we do at Formfast to help support hospitals and organizations to be more efficient, more effective, operate in real time. And these are some of the issues that Barry had brought up, and we just want to be part of the support structure to make these changes that are occurring happen, and happen more efficiently and more effectively. So with that, I want to turn it back over to our moderator and thank the audience once again. Thank you.
Sean, great insights. Thank you so much for joining us today and sharing them with us. That was Sean Curtis, Director of Product Management at Formfast. And thanks again to Gartner Vice President Barry Runyon for his insights and advice. To find out more about healthcare IT solutions and how Formfast can help your organization, go to www.formfast.com. Thank you.
Gartner is an impartial, independent analyst of the information technology industry. All content provided by other enterprises is expressly the views of those enterprises and the speakers. The information should not be construed as a Gartner endorsement of said enterprise's products or services.